the Rural Health Commissioner. This was an initiative and a campaign commitment by my forerunner, Fiona Nash, and very much the National Party. It was part of our policy push for several years before this, and we've announced it. The legislation was a bit of a hold-up because there is a queue. When you're down there in Canberra, you don't just walk in and put your paperwork on the table. It has to go through quite a lengthy process to get on the notice paper and then get into the Parliament and then get debated and then through the Senate and so on and so forth. And then we have had a merit-based selection process, and I was really pleased that we had so many high calibre applicants who pretty much all of them could have done a job, but I have, through that process, in case any of you haven't been online or listened to ABC or read The Australian or watched ABC News 24, I have chosen someone that all of you pretty much know already. He has had a career both as a practising rural GP. He's been involved in establishing several rural clinical schools, being a dean of a medical faculty, been an advisor to New Zealand, Japan, Canada and many other countries overseas about rural medical training, established new paradigms, published an awful lot of practical as well as academic research papers, mentored people, worked out how to deliver the very popular PGPPP and the John Flynn program, putting policy into action, which is what a Rural Health Commissioner will have to do, knows how the arcane workings of various jurisdictional health departments work, knows what they need so that they can administer things. So tick, tick, tick. And I'm very pleased and proud to be announcing that Emeritus Professor Paul Worley is the first National Rural Health Commissioner. Now, Paul is going to be a very busy fellow. The first task is implementing or not implementing, because there are, as I said, a very mature system in Queensland, but there are nascent and small schemes around all the other jurisdictions. And there is a requirement for the whole nation to get, every jurisdiction should have an equivalent of what they do in Queensland. That will involve a lot of policy work, a lot of meetings, a lot of negotiating with institutions called state health departments and territory health departments to put employment support behind that, because we all know most of the training will at some stage in getting rural generalism expanded will not just need like-minded general practitioners to train people in their community, primary care settings, but secondary care and hospital care is part of the training for rural generalism. So that's why the jurisdictions are pretty much part of this conversation. And that will be his number one responsibility. But as we all know, multidisciplinary care is what delivers good health care. And the same dynamic that we see, this metropolitan maldistribution and relative scarcity of medical practitioners in regional and rural and remote Australia, the same applies to midwives, nurses, dentists, pharmacists, OTs, physio. The whole box and dice of the mosaic of professionals is skewed towards metropolitan Australia. And all those university programs, due to demand-driven university access, have gone up exponentially, but we haven't seen the full dividends of all these extra professionals. He is called on to be a champion for rural health issues. He will be reporting to me. He will be supported by a secretariat, and he'll be working around Australia. He's going to be very busy. So I think that's the most awaited bit of information for a long time. Sorry about the delay, but we did have to go through an exhaustive process, and we've got a true champion. And Ewan, could I indulge and ask if you would I seek leave to give Paul a short time at the stand to just say a few quick words. Thanks very much.
David, an honour and a privilege to serve our country, to serve our rural health professionals and the 10 million Australians that call regional and rural and remote Australia their home. A great day for us all, because this is something that has happened not through chance but through a lot of hard work. A great day for our nursing and allied health colleagues, for our health administration colleagues in the jurisdictions, and as I said before, primarily for those people who call rural Australia home. Nelson Mandela said that education is the most powerful weapon with which we can change the world. So I don't think it's any accident that my first charge is to extend a national rural generalist training pathway. But of course, that pathway is not something that is coming off a blank slate. We are building on the shoulders of giants. In particular, I would like to acknowledge that we are building on thousands of years of health training in this place. That, of course, has been undertaken by our Aboriginal Australians. And we acknowledge that what we do is building on their culture of healing, their culture of community, their culture of family, which we see so poignantly in rural Australia. I acknowledge that that culture exists still today, and respect it and respect those people in the audience who are part of that culture. We are also building on 20 years at least of work that you have done. Work that successive health ministers at the federal and state level have supported. I think of people like Brian Howe, I think of Michael Wooldridge, I think of Nicola Roxon, and of course, David, we think of you and your work and your team and the work that Minister Hunt is doing right now. We thank those people for listening to health professionals around Australia when they have said, we need something different. We need a different model for rural Australia. Yesterday was a very poignant day for my state. We lost our manufacturing industry at Holden's. And I have been aware that many of the people in Adelaide have had a sense of despair, confusion, where to next. But I've also reflected that every person who lives in a small rural community, when their health service is under threat, feel exactly the same. Be they a pregnant woman who doesn't know who's going to be able to help deliver her baby. Be they an adult with a father or mother who needs aged care and they're not sure whether that can be close to home or not. Or whether that be someone with children at school not knowing how their child is going to progress. The care that we provide is the bedrock for hope in our rural communities. And I hope that as the champion for Rural Health Australia, on your behalf, we can increase that hope. Because health is a human right. Australia has a Commissioner for Human Rights. It is absolutely appropriate that we now have a Commissioner for Rural Health. Health is also an economic investment. We know that globally there's a 9-to-1 leverage for every dollar that is invested in the health workforce. And we know that the outcomes of that health workforce, which is increased length of life, for every increased length of life of 1 year, there is a 4% increase in GDP. So this investment in us all by the federal government is also an investment in the prosperity of rural communities. And the prosperity of rural communities has a great impact on the prosperity of our nation. So this is not just something for rural Australia, but is also something for the whole of Australia. I have said in the past in an article some 10 years ago in Rural and Remote Health that the systems we have set up have somehow left us one doctor away from a crisis in many of our areas. And many of the building blocks to change that, to move to sustainable systems, are in place. And you in this room have been responsible for many of those. We have missed a generation. It's been my generation in many ways that is missing from rural practice. And I thank God that our overseas trained doctors have stepped in and filled that breach. It is now time, though, for those overseas trained doctors to be given the opportunity to train our next generation of Australian doctors. As they too are now Australian, we have the opportunity to stand on our own 2 feet as rural Australia, to no longer be reliant on the release of doctors who are trained in a metrocentric model, to no longer be just rural doctors, but to proudly be rural generalists, serving our communities across the 10 million people that call rural Australia home, that call this wide brown land our home, that call this land of ragged mountain ranges, that call the land of the dual sea home, that call the land of terror and beauty. And that's where we step in, because there is a terror if your health is threatened. There is a hope if there is a health service that is sustainable. As Mark Craig, one of my heroes, said last night at our dinner, the charge of leadership is not to take charge, but to care for those who are in your charge. That will be my responsibility. That will be our responsibility as we provide hope for rural Australia. Thank you.